My name is George Groman, and I'm a clinical cardiologist with Cardiovascular Specialists of Central Maryland. A stroke is a series of symptoms that can show up in many different ways, but ultimately means that there's a loss of some aspect of central nervous system function. And it's due to usually a lack of blood flow to a vital part of the brain or due to a hemorrhage in that same area. Depends in part upon the size of the stroke, the remaining intellectual function of the patient, their willingness to put up with a certain amount of frustration as they practice to regain their speech, the frequency with which they're assisted with stroke rehabilitation, their comfort with family members trying to exercise efforts at speech again. And also, it depends somewhat on the location of the stroke itself and whether or not there are any secondary seizures that interfere with their capacity to express themselves. There's a pretty wonderful program over at Howard County General Hospital. It is run by Susan Groman, who happens to be my better half. It is a multidisciplinary effort at rehabilitation. The effort is assisted by physical therapists and by, of course, the physicians of record who are the neurologists. And it's a gathering of people to share their common experiences so as to express their levels of frustration, the tools that have worked for them, that sort of thing. They need to recognize the importance of modifying the risk factors that led to the stroke. So if they were a smoker, it's key to really stop once and for all. If they were severely hypertensive, to comply with their medications to reduce their salt intake, to be in the hands of someone who takes an interest in identifying possible secondary causes for hypertension, such as endocrine causes or renal artery stenosis, and get those things fixed. If, in fact, one has been sedentary much of one's life, it's important to start a gentle routine exercise program, provided there are no cardiac contraindications. If, in fact, atrial fibrillation was the underlying cause, then some form of anticoagulation is important.